And we didn't have that rigorous debate. And even now, we're not completely having that big rigorous debate because people are afraid of, what the administrators are going to say. And I think in the future, if we do these kinds of things, we need to have rigorous debate on everything.
So here, Alexa for Urban News, and I'm currently with one of the candidates of the Conservative Party of Quebec, Roy Eappen. He's a physician, doctor, and he worked as an assistant professor at McGill. He wrote the health program of the PCQ with other health workers, and as well, it started to rise up when he saw some inaccuracy in the health system and with the management of the government. He is against Bill 96 and he is against as well the coercion of what the government did during the pandemic. We will have a full interview, so I'm welcoming Mr. Roy Eappen.
My name is Roy Eappen, and I arrived in India from India in 1963. My father is a university professor was a university professor at Concordia University, but he came here in 1956 to go to McGill. He got a scholarship to McGill. Then he went back, married my mother. My mother got pregnant right away, and then we stayed in India while he came back to work. And then when he had enough money, because he came here by boat, he brought us here by plane when I was about 2. We lived on Sherbrooke Street next to the Montreal Association for the Blind, and then we moved on to Mariette, which is where I grew up, also in NDG, and then after that, I grew up. I went to Marianopolis College, and after that, I went to medical school. My mother's a doctor. My father's a nuclear physicist, so I have good genes. And I work at St. Mary's Hospital, which is part of the CUSE de West, and I'm an assistant professor of medicine at McGill University. So I've taught medical students for the last 30 years. I've been involved in politics for a very long time, but usually behind the scenes. And I met Eric through, I had known him a little bit before, but about 10, 12 years ago, we started something called the Réseau Liberté Québec, which is a movement to try and gather people on the center-right in Quebec, because we thought all of the parties in Quebec are left, further left, and communist. So we thought, we need something, we need different opinions. And we also thought this federalist sovereigntist thing was, had outlived its usefulness, because it was not really helping Quebec, and the discussions were quite divisive. So we had several speakers, and we were actually trying to get the ADQ of Mario Dumont elected, and later on Gérard Deltel. But what happened is the ADQ merged and became the CAQ, and we became discouraged. So we sort of stopped that for a while. And I think at one point Eric even voted for the CAQ. I think he thinks that was not such a good idea now. And about 18 months ago, Eric called me up and said, Roy, I want you to run with me because I'm going to run for the leadership of the Quebec Conservative Party. And I said, are you crazy? I mean, I don't want to do that. I mean, I have a very comfortable life. I don't need that kind of headache. And he said, Roy, I won't run unless you run. And after several phone calls like this, I finally said yes, and here I am. So the way he sort of convinced me is over the last 2 years, our healthcare system has been quite broken. I mean, it's been broken for quite some time. But in the last 2 years, we noticed that it was really not fit for purpose. Quebec had some of the worst lockdowns, worst measures, and we had some of the worst death rates. And the government in power now seems unable to change, and I think we have some actual proposals that will actually make a big difference. Mm-hmm. I sat on the political commission of the PCQ with some other doctors and other healthcare workers to work out a plan to improve our healthcare system, and that's where I'd like to go.
So we know that you are a physician, you work at the front line during the pandemic. You begin to be concerned when you saw a lot of inaccuracy. Can you talk a little bit of what you saw and how hard it was to be at the front line in the system?
Well, I mean, for me, it was just a lot of cruelty, unnecessary cruelty. We weren't allowing people to see their families when they were dying. We were letting them see, like, Facebook Live and things like that. We stopped that pretty soon. We found that we were somewhat rudderless. The Liberal Party of Quebec had made our hospitals very, very centralized. So we didn't actually have administration in our hospital. We actually set up our own administration because of these mergers of these CUSs. And that's one of our goals. We want to decentralize medicine. We also see many people, older people, pass away, and it's bad enough that you're dying. It's worse that you can't see those your vos proches, your family. And we were very tired. It was, everyone became very tired. Many of our nurses got sick. Many of our nurses quit the profession, and that's going to be a major problem in the future. And that's another thing we like to do. I don't think we have enough doctors. I don't think we have enough nurses. And I think we have a rich supply of immigrants to Canada and to Quebec who have credentials that we could use. So we need to recognize those credentials more quickly so that we can get more frontline healthcare workers on the line. And, people have said I'm a hero. It's nonsense. I'm not a hero. I did my job. And most of the time it was okay. But I got to tell you, even I got a little depressed during the last couple of years. Mm-hmm. At the beginning, I just didn't see my family and friends. But later on, I came to the conclusion that, things weren't as bad as all that. And I was careful, but, I started seeing people again. And a lot of my patients didn't see their families and friends for 2 years. Mm-hmm. I mean, I can't imagine if my mother was still around, if I had not seen her for 2 years, she would have hit me. Mm-hmm.
So as a physician, as a doctor, what is your thought about the management of La CAQ during that 2 years?
I think that they went too far. I think they politicized the management. For these curfews, there's no evidence for these curfews. In fact, there was a Radio-Canada report saying that they were yelling at the public health officials to find an excuse for these curfews. The second curfew in particular, I don't remember, you probably remember, on New Year's Eve, suddenly they told us all to go home. Restaurants they had opened up just recently, and restaurants had bought thousands of dollars worth of food, which was wasted. The first chance we were going to get to see our family and friends again for a while, and they shut it down. And I still don't know why they did that. Closing down the CLSCs to visitors. So the CHLDs, the old people, a place where older people go when they're quite ill. If you cut off the family from these people, they were visiting their family, they were washing their family, they were feeding their family. A lot of these people died of loneliness and neglect, frankly. There wasn't enough staff. A lot of the staff, didn't want to come to work. I think the management needs to be looked at again. I think we need our party has a policy where if you want to do those kind of lockdowns again, and I hope we never do them again, because I don't think they really worked, and we can talk about why they didn't really work in a minute. But we say that 80% of the House has to say yes to that. So we need a supermajority, a large supermajority to do such restrictive measures again, because even at the beginning, Mr. Arruda said he didn't want to do closing down things and closing down restaurants and the closing down of schools. a lot of poor children are going to lose so much education that it will affect them for the rest of their lives. And this is happening all over the world. And there are many, many reports of this happening. Mm-hmm. In the United States, 20 or 30% of the kids in the New York City school system have disappeared. Mm-hmm. They don't know what's happening to them. And there are several reports that kids have fallen 2-3 years behind in schooling. Mm-hmm. I mean, that's a catastrophe.
So you just say that the measure seems to haven't worked. Can you explain a little bit?
Well, let's look at the lockdowns. I mean, they may have worked initially, but you have to look at risk versus benefit. And the risks were not adequately looked at. So the closing down of schools, kids are relatively much lower risk of illness and severe illness from this disease, and we locked them out of their schools, and that caused a lot of trouble, a lot of loss of schooling. You know, if children were being beaten by their parents and stuff, their refuge was school. If women were being abused by their husbands, their refuge was to leave. All of that stopped, and so you know, those numbers got worse. I think people got poorer. A lot of people lost their businesses, and we have to look at the risk versus benefit. And I think the risk, the benefit was far outweighed by the bad things that happened. In the rest of the world, the rate of tuberculosis deaths has gone up. The rate of other deaths has gone up. The rate of poverty deaths have gone up. We've made a lot of people a lot poorer. So I think this has been a war on the poor and the lower and the middle class and the lower middle class. Mm-hmm. By the laptop class. Unfortunately, I'm part of that laptop class. But, you know, the people that were disputing these measures were called complotistes, were called, you know, crazy. But, you know, in the future, we need to have rigorous debate before doing things like that. We've never done it before. I mean, Dr. Tam, who is our Chief Medical Officer of Health in Canada, had a plan for pandemics. It never included any of these measures of closing down all the stores and closing down everything and closing down the schools. That was never there before. So why did she suddenly do it now? Mm-hmm. I think there were a few countries in the world that did it, and they thought it was successful, but it was not. If you look at all those countries, I mean, I think the Swedish people actually did the best job of this. I think most Quebecers are smart enough to make their own decisions. So you should have made public health recommendations, but I'm firmly against coercion, especially when it comes to matters of your own body.
Probably a lot of people will ask you if suddenly another pandemic will come to be a reality, what will be the best action plan to use?
I think protect the most vulnerable, and the rest of us have to lead our lives. You know, I would probably recommend less gathering in public spaces and stuff, but I would not do it as a matter of coercion. I would do it as a matter of and people are smart enough to make their own decisions versus risk. So I don't think that forcing people to do things is actually helpful. And in fact, things like the vaccine mandates have had terrible consequences in the fact that people no longer trust public health a lot, and the rates of vaccination for regular vaccinations have gone way down in children, like measles, mumps, rubella, polio. There are now cases of polio in the U.S. and the UK. So, you know, you have to keep this trust of public health for the population, and forcing people to do things is not the way to do it.
You want to decentralize the health system.
Yeah.
Some people are kind of afraid about, you know, all the implication on it. Can you just make it like really clear that people can understand how that would be good? So
there are hospitals in places like the Gaspé and Gatineau. They're 80 miles apart, and now they're one unit, and the administration of those two hospitals are in one place. So it's very hard to get, you know, anything done in the other place. Several of my colleagues have retired over this, saying that, you know, the health system has deteriorated. The CAC CAC has made some promises to decentralize. After we said decentralize, the CAC seems to like our programs. So we think, like most things, it's better to be at the local level. So I think we know the health needs of this community at the local level. If you put everything in a huge CUS, which is based in my CUS, everything is done from the Lakeshore Hospital, which is 20 miles away. So I think local autonomy is a good thing, because you know what the needs of your own community are. Mm-hmm. And as I said, during the pandemic, we had to set up our own local administration committee because no one was listening to what we were saying. And we thought we knew best on what to do in our own hospital.
Mm-hmm. Do you have the impression that all the physicians, scientists, and doctors have not been heard by the politic?
Oh, yes. I think there a whole bunch of people were being silenced. The college was saying, don't talk unless, you agree with public health. I don't think that's a great way of doing things. I think everyone needs to be listened to. Mm-hmm. Some of my colleagues were silenced by the college. That's not a scientific way of behaving. Science means rigorous debate. And we didn't have that rigorous debate. And even now, we're not completely having that rigorous debate because people are afraid of, what the administrators are going to say. Mm-hmm. And I think in the future, if we do these kinds of things, we need to have rigorous debate on everything.
Last word is for you.
Well, I think the PCQ is actually an alternative to all the parties now. Eric has done an amazing job. He's gone from 500 members to 60,000 members. We believe in freedom. We believe that Quebecers are smart enough to make their own decisions on virtually everything. And I think that the English community in particular should realize that they've been held hostage by the Liberal Party for the last 40 years. And what have they done for them lately? Things like Bill 96, they say that they voted against Bill 96, but they voted for it twice, and then they made it worse, and then they voted against it. So, I think that we are a good new alternative, and it's good to have a debate that's no longer sovereigntist and between sovereignty and staying in Canada. My party thinks that debate is over. The people of Quebec have spoken twice. We're going to stay in Canada, and I think we need to go on to more debates about the economy, about our future, and I want to make Quebec a more prosperous, a healthier and wealthier place.
So, 3rd of October, it will be the vote in Quebec. We will have a live stream during that night to show you what is going on during the vote election. If you want to join us and if you want to see all our report, go to quebecelection.ca, and in the same time, chip in generously so we can continue our journalism. Thank you very much.